forced down their throats by corporations and government officials and all that kind of thing. So I think that's also a good trend in terms of fostering independent thinking and counterbalancing the effect of all that money.
Great. Other questions? You've been very energetic, and then Josh has his hands up.
I wanted to present a model. One is healthcare services, and the other is fertility rates. And if you have a country that has a high fertility rate and low healthcare services, they're not going to. They have a big problem. And if you have a country like Japan or Germany that has very low fertility rates, they have excellent healthcare services. So you have to increase the supply of healthcare services as your population grows. And I don't think you've addressed the fact that we have to put out many more healthcare providers to cover just keeping even with the population fertility. And the second thing is that countries like Cuba that have a streamlined healthcare educational system are doing a great deal in third world countries by providing people that are semi-trained in healthcare. So I think we have to address the fact that we don't need the end of life intensity for most of the healthcare problems. We have to design a system that can provide basic health care, and I don't hear that being talked about either, of how we can provide services based on standard services rather than exceptional services.
You want to comment?
I could just comment that the primary healthcare movement is very much focused on providing basic healthcare to everyone. And we know that around the world, fertility rates are dropping, and that in many countries with high population growth rates, one of the rate limiting factors to reducing that is lack of access to family planning services. And so that's a major issue that's happening in much of the developing world right now. We also know that women, if they have access to education and other opportunities, are likely to pursue those and not as likely to have very large families that are hard to sustain and feed in these economic times. So this all links together, but these are important points.
Just one quick comment that relates back to Josh's talk last night on efficient allocation of resources. You know, in the United States, you go to hear futurists talk about the future of healthcare, and it's refreshing to hear someone like Robert talk about single-payer health. Because normally what I hear is the genome, decoding the genome and personalized medications and cameras in pills that we swallow, and all this other stuff that allocates resources to people who least need them. It gets at Josh's whole point from one of Josh's points from last night. So you can pay $1,000 to get your genome decoded. You can get a pill with a camera in it. You can do all these other things. But we have low immunization rates, and we have terrible food insecurity, and all these other things that would make a much bigger bang for the buck. But we don't go there because of our inefficient allocation of resources.
Great, Josh.
And my comment actually follows exactly on this. Is that looking at how we allocate